In the realm of fatal diseases, three stand out: heart disease, cancer, and chronic lower respiratory diseases. Heart disease, encompassing conditions like coronary artery disease and stroke, is often the result of blocked arteries. This can cause chest pain and reduced blood flow. Risk factors: high blood pressure, high cholesterol, diabetes, obesity, smoking, and lack of physical activity. Cancer, the uncontrolled growth and spread of abnormal cells, manifests in many forms, such as lung, breast, and colorectal cancer. Its risk factors include tobacco use, radiation exposure, obesity, viruses, and genetic factors. Chronic lower respiratory diseases, including chronic obstructive pulmonary disease, damage the lungs over many years, making breathing difficult. Risk factors include tobacco smoking, air pollution, and exposure to occupational dusts and chemicals. So while these diseases differ, they share common risk factors: tobacco use, poor diet, physical inactivity, obesity, and environmental pollution. By adopting a healthier lifestyle, we can prevent and manage many of these leading causes of death. A stitch in time, as they say, saves 9.